We know that the number of HIV and AIDS cases continue to rise in this country despite efforts to educate communities about ways to prevent the spread. Reporter Nathan O'Neill traveled to one corner of Arizona that is trying to get the word out, but getting people to talk about the disease is a huge challenge.
As a new day emerges over the desert,
we don't talk about a lot of taboo issues.
The people from the Navajo reservation are being forced to talk about some tough issues.
They think that if they don't talk about it, that it's not going to happen to them.
But this quiet, isolated community is now having to deal with a big city problem. A problem Jerry Archuleta knows all too well.
This is one of my HIV meds.
He's one of a growing number of HIV cases among the Navajo people.
At first it was, frightening.
Jerry and his partner Emerson Scott were like many others when first hearing the news.
As we learned more about it, we began to understand, that it wasn't necessarily a death sentence for us.
But getting that message out is a challenge here on the reservation.
They kind of look at it as a curse.
While the Navajo community is the largest Native American reservation in the U.S., money for education about HIV is scarce, and that's a huge problem as cases start to soar. The Center for Disease Control says that of the 5,000 Native Americans living with HIV in the U.S., almost 1 in 4 don't even know that they have it, which is 5% greater than the national average. And that's especially a problem for some of the people who come to the Indian Health Center in Gallup, New Mexico. Here, Dr. Jonathan Irlu treats HIV patients and says people are shocked when he diagnoses them with HIV.
When I first came here, we used to say, oh, HIV is a disease that you acquire in the big city. You move back home to these rural areas and you bring the disease here.
But now it's spreading on the reservation itself. There's been a doubling of new HIV cases in the past 10 years, 35 to 40 new cases each year.
We think our numbers are a lot greater.
And that scares Melvin Harrison, who is passionate about preventing HIV from becoming an epidemic on the reservation. Director of the Navajo AIDS Network in Chinle, Arizona, he travels to the far reaches of the reservation, providing cultural and medical support for those who need it. He blames the extreme poverty, isolation, and lack of education for the spread of the virus.
We're trying to say HIV is a big thing here. Our numbers are doubling. They're not hearing that because, there's so many other issues they're dealing with.
So Melvin travels the reservation, helping out one person at a time. Melvin and Jerry, two men connected by more than just friendship, both trying to make sure that this disease stops taking lives on the reservation.
I wish I had done things differently, but then I'm kind of glad that, it has turned out the way it has simply because it gives me an opportunity to help somebody else.
On the Navajo reservation, I'm Nathan O'Neill, Cronkite News.
Right now, more than 170,000 people live on the Navajo Nation, and Melvin says he's fighting to get more federal and state money to expand his education program to reach more of that community.